BD Autoshield Duo is a safety pen needle that is designed to help protect healthcare workers and caregivers from accidental needle stick injuries. BD Autoshield Duo features two safety shields, one that protects the patient end of the needle and a second that protects the back end after the needle is removed from the pen. Both safety shields are automatically activated to help prevent needle stick exposure and injury. Let's review how to properly use the BD Autoshield Duo safety pen needle. Remove the pen cap and wipe the rubber seal with an alcohol swab. Pull the peel tab off the pen needle. Next, holding the outer cover, screw the pen needle straight onto the pen. Remove the outer cover and check that the pen needle is attached correctly. Before delivering the injection, you must prime the pen to ensure the needle is open and working. For most pens, rotate the dial on the pen until 2 units is displayed in the dose window. Hold the pen in the palm of your hand and depress the dose button with your thumb. You should see a small drop of liquid at the needle tip. If no liquid is visible, dial an additional 2 units and repeat the priming step. Finally, dial the prescribed dose on the pen following the instructions of the pen manufacturer. Next, choose an injection site. The recommended injection sites are the abdomen, thigh, buttock, and upper arm. Be sure to rotate between and within sites and ensure injections are always a finger's width apart. Once the injection site has been selected, disinfect the skin. To minimize the risk of needle stick injury, the use of a 5mm needle without a pinch-up technique is recommended for most patients when given by a healthcare worker. Inject into the skin at a 90-degree angle and in one continuous motion until the white sleeve touches the skin. Maintain constant pressure against the skin. Do not change hands. As the needle is inserted into the skin, the clear safety shield slides up into the white sleeve. You'll know that the needle has fully penetrated the skin when the white sleeve is flush with the patient's skin. Push the dose button down to administer the dose. Leave the needle in the skin for up to 10 seconds after the dose button is fully depressed. After the injection is given and the needle is removed from the patient's skin, a red indicator band appears inside the clear safety shield. The safety shield is now locked in place for your safety, and the pen needle is safe to remove. Hold the white sleeve of the pen needle and twist it off. The pen connection end of the needle is now protected with an orange shield. Dispose of the pen needle in a sharps container.